Retino-A 0.025% or tretinoin cream is a form of vitamin A that is used to treat acne, which appears as spots or pimples on your face, chest, or back. It also helps to smooth rough facial skin and to reduce fine wrinkles on the skin. It usually takes several weeks to have a noticeable effect, so keep using it even if it appears not to be working. Sometimes acne may get worse before it gets better. However, with proper use, your skin will get clearer. The earlier you start using it, the less likely you are to get scars. Ideally, a pinpoint application at night time is recommended for the duration prescribed by your doctor. The amount you need and for how long you need to take it will depend on what you are being treated for. The most common side effects include irritation, dryness, and redness of the skin. They are usually mild and improve as your body gets used to the medicine. This cream may make you more sensitive to sunlight, so you should limit exposure to the sun if possible. It may make your skin more fragile. It is advised not to have any waxing or laser treatments during this treatment. Use protective measures such as sunscreen or protective clothing. It is generally not recommended in pregnancy.